Dr. Archana Sarda from Aurangabad. I run an NGO called Udan, which serves children with type 1 diabetes who are underprivileged and come from less resourced areas. I am a diabetologist and I have been working in this field for last 20 years. Today we are going to talk about type 1 diabetes and how it affects all our lives. Even if I do not have a child with type 1 diabetes in my family, yet it is very important for me to know about type 1 diabetes because it can touch my life in many ways, anytime, any day. What is type 1 diabetes? Type 1 diabetes is the kind of diabetes in which suddenly the insulin is no longer manufactured by the beta cells in a child's body. I am saying a child, but it can actually happen at any age. From birth to even adulthood, there can be a time when suddenly insulin is not being formed. Hence, this person, this child, girl or boy, needs to take insulin injections to survive. If they do not take insulin injections, this insulin injections, that 2, 3 to 4 times a day, it is life threatening. Now, whenever a person has child with type 1 diabetes, the first part is trauma. There is a lot of stress. First thought is it cannot be true because we think we are in denial. Hence, we've tried to go from doctor to doctor, trying to change the diagnosis, trying to ask everyone, tell us this is not true. How can a child have diabetes? We thought it was about the older people. Once we know and the doctor tells that it is, then comes the shock of having to take insulin. It is okay if we have to take just a pill. Somehow we have a mental block against pricking. Again, with the pricking comes the pricking of checking the blood sugar. Then there comes the cost, which is also a shock for any person whose income is not that much. So with all these shocks comes the shock of society. When everyone will come and say that, oh, your child has type 1 diabetes, you are taking insulin injections and this and blah, why don't you go to that Baba, why don't you go to that Fakir? And all these things put a person in a fix. So today, I want to talk to you, all of you, about what actually happens. Do you know that the Prime Minister of UK today is Theresa May and she has type 1 diabetes? Do you know that Wasim Akram is a type 1 person with type 1 diabetes as the fastest bowler from Pakistan? So there are so many people. I can go on, the list is endless. I'm just quoting a few famous people. So people are capable of living their life for whatever is the natural lifespan, totally comfortably achieving their dreams and healthily. They can get married, they can have kids, they can pursue their career, they can climb the Mount Everest for all you know. So nothing is a barrier for a person with type 1 diabetes. Yes, every type 1 has to take insulin. As of today, we do not have a substitute to insulin injections. Maybe person who can afford can put a pump. And a pump is a modern way where the pricks are less, the delivery is much, it costs anywhere between 1.5 lakh rupees to 7 lakh rupees. Depending on our affordability, we can opt for a pump. But if we cannot, we have devices which are also almost painless. They are easy to carry. But if we cannot, we have a vial and we have a syringe. Doesn't matter. Even with a vial and syringe, if I do not have the budget, I can still live healthily and control my blood sugar. Second part is monitoring. And again, monitoring can be done by a glucometer and strips, which are not very expensive today. Another aspect is that one has now devices which one can apply, which will continuously monitor your blood sugar levels. So there's a lot of technology happening to offer to people who are capable of buying it. But if you're underprivileged, then it becomes an issue. So it's very, very important whether it's insulin, it's a healthy diet, or it is monitoring, whether it's rich or it is poor. But in every case, it is totally possible to control one's blood sugar if one realizes that I can live a fulfilling life through proper management. We have talked about the logistic leads. You need insulin, you need a monitoring system, you need a healthy diet. We are not talking about diabetic diet. There's no such thing as a diabetic diet. What a child needs to grow, needs to eat healthy, needs to have a balanced diet, needs to learn carb counting. Now, these are the three basic things which a child needs in type 1 diabetes. Now, to be able to do that very well, what one needs most is two things. One is education, the other is willpower. There is no substitute to education and willpower. Whatever one lacks in terms of better equipment, one can compensate by a very good education in care of type 1 diabetes, empower oneself, and if you have the willpower to do it, it is very much possible. So, my message to all those families who have children with type 1 diabetes is find somebody who will educate you, finds a group, give a peer group learning. What is most, when you say, why me, then when you see another 50 children like you, when you see another 100 children like you, when you go on treks together, when you go on picnics together, which is what we do in Udan, it gives you more strength than any assurance that can be given verbally. So learn a lot, meet a lot of people, keep a positive attitude, give your child a dream, and then medically control a child's diabetes. We can give every child with type 1 diabetes a fulfilling life, and there is no reason to deny it, even if we do not have the financial resources. Thank you.